Hi, this is Dr. Perry Carpenter. I'd like to thank you for taking the time to join me on this month's video. This video is being recorded on February 11, 2015, and this is our second video of the year. I hope you are enjoying our videos. For last month, we produced a video about how to increase the probability of success for your New Year's resolutions as relates to health, fitness, exercise, and getting in shape. And I hope that the ideas contained in that video were helpful for you. And at this point, I'm wondering how you're doing. How are you doing on your New Year's resolution? May not have a chance to speak to each and every one of you, but I'm wishing you success in your New Year's resolutions. And if you have any questions, concerns, or need any ideas about how to begin an exercise program, I want you to know that you can call me at any time and I'll help you out. I am a credentialed expert in the fitness training industry, and so I'm more than happy to help you out. Now, for this month, what I want to do is I want to talk to you about some practical ideas that you can implement immediately to increase the likelihood of having a long-lasting and fully functional back. In other words, what I want to talk to you today about has to deal with back pain, back injury, and you. And so let me establish a little bit of philosophy before I get into those ideas and suggestions. You know, for those of you that know me and have been seeing me on a regular basis, you know I've been a chiropractor for now 28 years. And when I first started working as a chiropractor, it seemed like for the first 5 or 8 or 10 years, I was seeing conditions and injuries and patients newly. I was seeing everything for the first time. And as the years started to accumulate, I started to notice patterns developing and recurring themes developing as patients came in over and over and over, telling me about their back pain, about their neck injury, about their stiffness and their weakness. And I started to notice recurring themes. And all of that was solidified for me at some point around 2005 when I was doing some research in workers' compensation injuries. And those of you that know me know I do a lot of work in workers' compensation. I examine injured workers all over the state for the Division of Workers' Compensation, and I'm also a continuing education provider for the Division of Workers' Compensation. So I do a lot of work in workers' compensation, and I was reviewing some studies in 2005 that was talking about the causes of injury in workers' compensation. They were investigating what we refer to as the mechanism of injury. The mechanism of injury. And what these studies revealed is that 80% of all back injuries, neck injuries, spine injuries in general, were caused by 20% of the possible causes of injury. It was another example of the 80-20 rule. So let me give you an example. Let's say, for example, you work at Costco. You work in the tire shop. And you're walking by a rack one day, and all of a sudden, out of the blue, a tire falls off the top shelf of the rack, comes down, hits you on the shoulder, drives you to the ground, and you injure your lower back. Or let's say you drive a delivery truck for Doritos chips. And you're on the freeway one day and you're hit from behind by a semi-truck and you whiplash your spine and you're injured that way. Or let's say you're a painter and you're working on a building and you're up on a scaffold and you lose your balance and you fall to the ground and land on your back and you injure your back that way. Well, those three examples that I just gave to you, those represent the exceptions. Those represent the freak occurrences, the accidents that rarely happen. Those constitute but a small minority of the mechanisms of injury that result in spinal injury. More commonly, in fact, overwhelmingly common are injuries that are due to really one main recurring common scenario, one situation, and that is the failure to use the spine in the way that is properly designed to be used. In other words, it's a failure or a violation of normal rules of body mechanics. Now, for you as a lay person, you can't be blamed if you suffer a back injury due to violation of body mechanics, because when we're born and when we're growing up, no one ever gives us a spine owner's manual and tells us, here's how you bend, here's how you lift, here's how you stoop, here's how you do all these things so you don't injure your back. Nobody tells us that. And so many times we have to learn this the hard way. And many times we injure ourselves or suffer chronic recurring pain, not knowing why, but it's simply due to a violation of normal mechanics of the spine. So what I want to do today with you is share with you just a few simple rules about how the spine works and how the spine doesn't work. And then I want to give you some practical tips and suggestions that will help you from now until the end of our days, or the end of your days. Okay, so to begin our discussion on the normal mechanics of the spine, I want to take you all the way back to high school or college, if you went to either of those. And I want to take you back to your classes in geometry. Now, I don't know about you. I don't know if you've ever taken geometry. I took geometry, and I think I took geometry in 1977 or so as a sophomore in high school. And if you ever took geometry, you remember that they talk about three planes of space. Three planes of space. And in geometry, they label the three planes of space X, Y, and Z. So space is three-dimensional, and the three planes of space consist of the x-axis, the y-axis, which is at a right angle to the x-axis, and then the z-axis, which is at a right angle to both of those axes. The three planes in space. Now, if you never took geometry, but perhaps you've done some work in carpentry or in interior design, you know that we have length, we have width, and we have height. In other words, when you look at a house, it's a certain number of feet long, certain number of feet wide, certain number of feet high. Those are the three planes in space. Length, width, and height. X, Y, and Z. Well, with regards to the human body moves in each of those three planes of space. Now, with the human body, we don't refer to length, width, and height, but with the human body, we refer to movement in this direction as movement in the sagittal plane. So I'm demonstrating spinal movement in the sagittal plane. Movement in this plane, which would be like this, we refer to that as movement in the coronal plane. Coronal plane. So these are coronal plane movements. These are sagittal plane movements. Well, the third plane, the vertical plane, we can move around this axis as well by doing rotational movements. So this is rotation, and this is movement in what's referred to as the transverse plane. You don't have to remember these. I'm just laying the foundation for the philosophy of this principle. Well, interestingly, the spine moves in two directions in each of the three planes. So, for example, in this plane, the sagittal plane, I move this way, we call that flexion, and I move this way, we call that extension. In this plane, I have right side bending, left side bending. In this plane, I have left rotation, I have right rotation. We have two movements in each of three planes. That gives us our 6 normal ranges of motion of the spine. So for the neck, I have flexion, extension, right side bending, left rotation, right rotation. And the same goes for the lumbar spine, the lower back as well. Now, the spine moves great in each of these three directions. It has good range of motion and it has good strength throughout the range of motion. Now, problems arise when we violate the normal planar movements of the spine. And what happens is we start to do movements without thinking of it by putting together multiple planes of motion at the same time. So for example, we do a movement in this direction, but then we add a movement in this direction. We do a sagittal plane motion and we add a frontal plane motion. Or we do a transverse plane motion and then we do a sagittal plane motion. Ah! The spine doesn't work good that way. The spine works best doing uniplanar motions. It goes really good in flexion. It goes really good in side bending. It doesn't go so good in side bending and then flexion. Ah! Problems arise when we violate the rule of combined motions. That's today's principle. It's the rule of combined motions. Now let me give you an example. When we put together multiple motions of the spine, when we try to combine multi-planar motions of the spine, not only does the range of motion of the spine rapidly diminish, but the strength of the spine to withstand load rapidly diminishes as the range of motion deepens. So let me illustrate those principles. For example, if I want to demonstrate the great range of motion of my neck in the movement of neck extension, I could do that by showing you how far back on the ceiling here I can see by leaning my head back in extension. So if I try and identify a point back there on the wall as far back as I can see, okay, I have a spot in sight back there. I'm making a mental note of it. I see it back there, okay? It's the furthest back spot I can see. Now, if I first add in a rotation and then try and lean my head back to locate that same spot, you'll notice I can't do it. I can't do it. Ah, and there's a pinch over here. See? If I first put together a movement in this direction and then add in that same sagittal plane motion, I can only see barely up to this light. The neck simply will not go back as far as it could with a uniplanar range of motion. So that's a demonstration to show you that the range of motion rapidly diminishes when you put together these multiplanar motions. Well, what's even more profound is that the strength of the spine drops off even faster than does the range of motion when you put together multiplanar movements. So I'll demonstrate in that in just a minute, but let me give you the practical application of this. Many times in the chiropractic office, we see whiplash victims who are hit from behind and their head rapidly goes back into extension. It's a whipping back into extension. Well, those injuries are always greatly worsened or greatly magnified if the patient or the examinee was first looking in the rear view mirror. See, looking in the rear view mirror, they have a head rotation and a slight head extension, and then they're hit from behind and driven back. And because the range of motion is not there to absorb this impact, the injury is always much greater. The same thing happens if the occupant of the vehicle is looking in the side view mirror. Here they're rotated and flexed forward looking down and then hit from behind. Ah! And injuries are always much greater. Now in the workers' compensation setting, what typically happens is a person, let me adjust the camera, what typically happens is a person will be bending over to lift some object, like a 50-pound bag of dog food, a bucket of paint, whatever. They'll be bending forward like this, doing a sagittal plane motion. But then what they'll do is they'll twist and put it over here. And they're adding in now a transverse plane motion. Now the spine works great in flexion. It also works great in rotation. But when you put together a flexion with a rotation, the range of motion quickly drops off. And the strength of the spine drops off even steeper if we drew it out on a graph. And what these workers' compensation studies were showing is that constant violation of these rules, putting together combined motions, was the cause of the majority of the back and neck injuries that workers were suffering. So here's today's principle. Here's the take-home message. What I want you to do is I want you to take a look at your daily activities that you do. As you go throughout your daily activities at home, at work, in the garage, in the yard, whatever, start to identify those times when you're doing combined movements. For example, are you unloading the dryer by bending forward and reaching in there in an awkward angle and putting together these combined motions? Are you making the bed, reaching and twisting and bending and pulling and getting into these positions that we could simply call these, we could just call them awkward positions. We don't have to call them multiplanar combined movements. It's just awkward positions. I want you to identify the times that you're doing these awkward positions. First of all, recognize those. And then number two, begin to eliminate or reduce the numbers of those combined movements. Now, it's not going to be possible for you to totally eliminate every single combined movement that you do. We live in a world with gravity, and we have to get some things done, and it's not going to be possible for you to totally and completely eliminate every single one. But if you can reduce them 80%, that will go a long way toward keeping your back pain-free and reducing the likelihood of ever suffering a back or neck injury. So that's number one, is to identify and reduce the numbers of combined movements that you're performing. And then number two, what I want you to do is, as you begin your day and you start doing your daily living activities, take your back and take your neck through the normal 6 ranges of motion to get it warmed up, loosened up, and to get it flexible throughout the entirety of the ranges of motion, so that when you go to do your activities, even if you do include some of those combined movements that we talked about, you're at least warmed up, you're at least flexible, and you're better able to withstand and better able to tolerate some of these combined motions. So there's the practical suggestions today, is first identify and reduce the number of combined motions that you're engaging in on a daily basis, and try to eliminate them as completely as possible. By eliminating combined motions, what I mean is square up to your work. Square up to your work. If you have to do something over here to the side, like unload the dryer, square up to it so that your movements are uniplanar, not multiplanar movements, as we talked about. So square up to your work, eliminate as many of the multiplanar movements as possible, and then also perform a brief warm-up in each of the ranges of motion to get your spine and your back and your neck warmed up and ready to engage in the activities of daily living. So I hope these suggestions help you. If you just simply implement this one suggestion, this will keep you much happier and keep you feeling much better. So this is Dr. Perry Carpenter. I hope that helps you. Please feel free to share this with your family and also your network over Facebook. And I want you to know that if you have questions of me at any time, I'm always available to take your call or your email. So it's Dr. Perry Carpenter. I look forward to being with you next month. And for now, I'm wishing you best of success and health in 2015.